When a tooth is lost, your fixed replacement options include a bridge or an implant. Both may be viable options, but today we will take a closer look at an implant. What is an implant? An implant is a titanium post that is surgically placed inside the patient's jawbone. It replaces the root of the tooth. The bone cells then grow around that implant, and after roughly about 3 to 4 months, the implant is integrated within the bone. And we can start the next phase of treatment, which is placing the crown, the part that you actually see in your mouth, on top of that post. This would be the functional part of the implant that you will chew with. Often patients ask us these most common questions. How traumatic is the implant surgery? Well, an implant surgery is not necessarily a traumatic procedure as compared to removing a tooth or an extraction of a tooth, which is a traumatic procedure. Patients tend to have less post-operative pain and discomfort after an implant surgery. Why would I get an implant instead of a bridge is another question. There are many advantages to implants over bridges. For example, an implant does not involve drilling into the adjacent teeth, unlike a bridge, which involves shaping of the adjacent teeth beside the missing tooth. Also, you cannot get a cavity on an implant. It is not a tooth structure that can decay. Unlike a bridge, which you can still get a cavity on a tooth that's holding a bridge. So in a lot of cases, it would make sense to get an implant. What is the success rate of an implant? A lot of people want to know that. Well, we can safely say that it's anywhere between 95 to 97%, specifically in cases where there are not any local or systemic problems. Local issues, for example, can be uncontrolled gum disease or a compromised quality or quantity of bone. That is why it is important to have a proper assessment done to see if you are a good candidate for an implant. Systemic issues can include uncontrolled diabetes, for example, or the use of bone strengthening injections of a group of drugs called bisphosphonates. These are most commonly used in women. Again, you need to speak to your dentist to see if you are a good candidate for an implant. I want to highlight some important points about implant treatment. It is an advantage to have your entire case planned and provided by the same dentist. Apart from the convenience to the patient, it prevents any miscommunication that can happen between the provider who is surgically placing the implant and the dentist who is restoring the implant or putting the crown on the implant. However, in some complicated cases, it is necessary or required to have the surgery performed in a more advanced surgical setting. Another thing to consider is that usually a CT or a dental CT scan is necessary before an implant is placed. These can only be performed in specific centers and not readily available in all dental offices. Luckily, we at the Dental Smile Center have this service in our office available. Our dental CT scanner makes things much faster and more convenient for patients who are needing implant. We work together in a group of general dentists and dental specialists at our office, and if you think that we can help you with any of your dental needs, please give us a call.